A patient presents with a hard, palpable swelling on the upper right leg. The immediate fear? Bone cancer. In radiology, we often call this an incidental finding with a shock factor. Today, we're analyzing why this massive 10-centimeter mass looks terrifying on an X-ray, but actually carries one very specific feature that changes everything. In the X-ray of the lower leg, we can clearly see a massive bony outgrowth on the fibula. This is what we call a sessile cartilaginous exostose. Now, here is the clinical secret. The lesion has a broad base and a continuous connection to the bone's medullary cavity. Think of it like a branch growing perfectly out of a tree trunk. However, with an extension of over 9 centimeters, this bone mountain is already putting significant pressure on the surrounding muscles. To rule out a malignant transformation specifically, a chandrasarcoma, we must perform an MRI. Our main focus here is the cartilage cap, which covers the tumor like a hat. As a general rule of thumb, any cap thicker than 2 centimeters is highly suspicious. In our patient, it measures exactly 1.0 centimeter. This is a very reassuring sign of a benign process, even though the margins appear somewhat irregular on the scan. Despite being benign for now, the mechanical stress is enormous. The exostose shows several bony protrusions extending inwards and downwards. This can irritate tendons or even compress nerves. That's why a surgical resection is being discussed. A major red flag for the patient is localized pain, which could be an indicator of renewed growth or even a transformation into something more dangerous. In summary, a classic osteochondroma. Large, imposing, but according to current imaging, not malignant. Have you or anyone you know ever dealt with these types of bony growths? Let me know in the comments. And if you want to support my work, the coffee link is in my bio. Thanks for watching.